Close your on. Okay, we're going to try again. Thanks for everybody who's helping us know whether there's audio or not. We're just going to go through some of the... So the way I like to structure my talks is from the simplest thing to the most or more intense thing that you could do for your neck. So again, just a reminder, we're talking about neck needs today. And the previous slide, one more reminder, please don't take photos of our slides. If you want to talk to us about anything, you can reach us at the office. But even though our patients gave us permission to use their photos, we prefer if you don't take any pictures or use any of our patient photos. So the first thing that I want to tell you, even before we get into medical grade skincare, is I have a very disappointing thing to tell everybody. There is no such thing as a non-surgical facelift. So that's one of the main things that people ask me about. And people come into the office asking me, hey, this is what I want to happen. And I'm sure all of you do this in front of Zoom and pull your jawline back and look at yourself that way and hope that there's something that you can do that's going to give you that outcome without surgery. And I am not a believer that everybody has to have surgery, even if you would benefit from surgery. I actually love to talk to people again about the least intense thing you could do that would make you happy. But I just want to give the disappointing news that there is no shortcut to getting rid of extra skin or moving parts of your face without surgery. So if that's what you're seeking, everything we're going to be talking about today is the next best thing. And sometimes the next best thing is the best for you. So, of course, medical grade skincare is the most straightforward of all of the things you can do for your neck. A well hydrated neck is going to look better. However, there are no necessarily miracles that are going to happen. My favorite is the Restorative Neck Complex by Alastin. I actually keep it by my coffee machine. Any of my good friends who are watching will know that they come to my house and they'll be like, why is your neck cream next to your coffee maker? That's so I don't forget. I just do it when I'm making coffee. And so then instead of having a super complex morning and night routine, I just pull that out of my routine, keep it next to my coffee, and do it that way. And it's a really great way to make sure you get it in daily. So now we're going to move on to the next thing known as neuromodulators. People will use the term neuromodulator interchangeably with the term Botox. The way I like to propose that to you is that it's the same thing as saying Kleenex is the same as tissue. Neuromodulator is the name of that class of action of injectables, but then there are quite a few on the US market, and I can mention to you in a moment the ones that we have at Clear Dermatology. And I also like to tell you about how neuromodulators work because they're great in the neck. And if you stay tuned, I'm actually going to do a live demo, and I'll tell you when, to show you how easy it is to get a great effect from neuromodulators in your neck. And what happens with neuromodulators, and I'm going to show you a little picture in a moment, is they're used to soften movement of muscles. They're not actually wrinkle treatments. And I'll go through that with anatomy in a moment. So here we go. This is a schematic of a muscle. You can see it, the red fibers, and a nerve. And I put a little X to show you what's happening with neuromodulators. So what happens is the nerve cannot tell the muscle to move, but the neuromodulator, which again, at Clear Dermatology, we have Botox, Dysport, Xeomin, and Daxxify. If you have questions about these and the differences, or if you think there's anything you want to know more, we can come back to that in Q&A. But they're all FDA approved on the US market for cosmetic use. So back to the way that they work, which I think is really important for people to understand. The nerve does not get damaged and the muscle does not get damaged, but the message can't get through, so the muscle doesn't work and the wrinkles don't show. One thing to keep in mind is that your body outsmarts it. Your body will make a new pathway, and it's a little more complicated than that, in order for the nerve to start working again, which is why these treatments are not permanent at all. In all of the FDA trials for all of the neuromodulators on the market, They tend to last between 2.5 to 3.5 months, maybe a little bit longer with some, but there's really not a huge variation in that. And that depends on each individual's capability of outsmarting it and making the pathway work again. Importantly, in the neck, I've shown you a schematic of the muscle in the neck that will be affected when you use a neuromodulator. Another really important thing is this muscle called the platysma muscle, which you see drawn in both of these, pulls down. So we can take advantage of the fact that it pulls down because think about it, if we make the pull down not work, you might get a tiny sharpening of your jawline or a tiny change of, I hesitate to use the word lift because I already told you there is no such thing as a lift without surgery. However, if the muscle cannot pull down, it definitely can shape the jawline and can also be useful in the neck banding. I'll talk to you a little bit more about neuromodulators and neck banding during live demo so you can see more about how that anatomy can be positively affected with neuromodulators. The way neuromodulators in the neck are described is what's called a Nefertiti lift. And I actually love Queen Nefertiti. I saw her in Berlin when I was around 8, and I had a poster of her growing up in my room. She's just a beautiful queen, and she's historically considered to have one of the most beautiful faces and jawlines. So again, neuromodulators in the neck were originally termed by Dr. Levy, who originally came up with the idea, as the Nefertiti lift. And I think that's just a wonderful way to think about it. Filler can also be used for the neck. So the dermal fillers that we have on the market can also be injected into the neck to smooth out the fine lines and wrinkles. And we commonly term those fine lines and wrinkles necklace lines. I mean, they're not as fun as a diamond necklace, which is what I have pictured here in the webinar, but it's just to remind you it's those lines that go around. Filler can also be used to enhance the skin quality of the neck. So biostimulators such as Radiesse and Sculptra can also be used in the neck to encourage new collagen. But frankly, in studies have shown that anytime you inject filler anywhere, the stretch process will encourage new collagen to come into the neck. So now we're going to move on to some of the devices that we have available. Again, I'm not going to say that any of these devices can create lifting, but they can absolutely smooth and tighten, not in an upward direction or in a lift type direction, but in the area which is treated. One of the most popular is called SoftWave, and SoftWave is non-invasive using ultrasound technology. It stimulates collagen production and improves skin laxity, again, a form of tightening. It's non-invasive and there's no downtime, maybe a little redness, and it's a very quick treatment. It does take about 3 months to see the effect, so something to keep in mind, but that's true for almost all the devices that we use, that this change in collagen takes time to occur, even though the signal for it to occur happens at the time of treatment. So here are some pictures of SoftWave before and after, and note again that we did them 3 months after the treatment in order to show the effect. So it won't be immediate. So if you have something coming up, all of the things that we're talking about, you should consider treatment quite a bit ahead of time. In terms of neuromodulator, they take about a week, but if there's any bruising and you're concerned about that, so consider 2 weeks for neuromodulator, 2 weeks for filler to take effect, and then 3 months for any of the devices that we're going to talk about. And just a few more that you can take a look at, the change that you see from SoftWave, again, no downtime, minimally invasive, just has very little by way of numbing that is associated with it. And then a couple more of SoftWave before and after. Really nice, but also subtle changes in jawline and neck. Here's another one to take a look at. I think this one is a great one to see how you can see changes in the fine banding. I will get back to this in our live demo, but if you take a look at these bands, they are subtle And so you can't expect large bands to react in the same way, but these early bands that we see in early aging or in mature necks are certainly great to treat with the soft wave. So now we're going to move on to Fraxel, which is the favorite of our lasers here at Clear Dermatology. Also minimally invasive, but it does have some downtime. You have to imagine a little bit of redness, maybe a little bit of browning and swelling for about 5 days. Also, we usually recommend more than just one treatment, whereas soft wave is just one treatment. So Fraxel also is great for most skin types, but you'd have to see somebody for consultation at our office to determine if you would be a candidate. It's great for fine lines, brown changes, and you can actually treat many areas of the body, not just the neck, but the face and neck are favorite areas for Fraxel. Again, we say results in just 1 to 2 treatments. Takes about 3 months to see your initial result, but usually it's a few more. I always say more closer to 3 treatments to see best results. Another thing about Fraxel, we do recommend that it's done in the fall or winter because we don't want any pigment changes or increased risk in pigment changes from the sun, especially the strong sun that we have here in Arizona. So here are some really nice pictures of the Fraxel, and it gives you an idea. You see that 24 hours, some redness, some browning, which is normal. The Fraxel has this really cool thing called a melanin shuttle, which means there's a little shuttle in your skin that kicks out. It's almost like a little bus that picks up all the pigment and takes it to the surface and kicks it out. So you're starting to see that at 24 hours. And then at 20 days, there is an improvement already seen in the browns, but in the wrinkles, we usually see them a little bit later. Agnes is also a little bit more of an intense treatment, uses radio frequency energy and uses needles to push energy into the skin, giving it a tissue response. But the top layer of skin is not damaged, nor is the top layer of skin changed at all with the Fraxel. It travels straight through. So radio frequency is monopolar and it delivers energy. All of these work in some ways this similar, that the energy causes a change at the cellular level to make new collagen and to improve pigment. So here is some Agnes. One thing to keep in mind with Agnes in terms of downtime, like Fraxel, there is some downtime, unlike soft wave. I tend to think that if you can tolerate a little more downtime, everything in life has a give and take. So a little more downtime might lead to a little more of a stronger result, but all of them do give results. So here's baseline and 7 months. Agnes also takes about 3 months to see a result. So surgical solutions do exist. I am a facelift surgeon. If you want to check out some of my facelift results, you can go to my Instagram at Dr. Lisa D. Grunenbaum and follow me there. However, I really wasn't talking about that today, except to give you the bad news that I already gave you, that there is no such thing as a shortcut. However, I always like to say that there are surgical solutions. I'm happy to talk to you about them, but I like to focus on next best things because that's really what people like to learn about. So here's some of the webinar specials that we're offering only associated with the webinar. So they have to be done either the refresh or the face and neck revival, and then you can do these enhancing add-ons. So there's Agnes, and they both come with a really nice skincare, I call it a skincare treat, but a skincare bonus. And they have VIP pricing associated with them. And if you have any more questions about these, you can talk to our office about them. But right now we're gonna take a little pause and get ready to do a live demo and talk to you more. And the other thing that I wanna mention, the promotions end at 4 o'clock tomorrow. They're really only available associated with the webinar and until 4 o'clock tomorrow. And the first 5 patients will get a complimentary elastin neck complex, the one I already told you that I have by my coffee to enhance. It's a $142 value. And then you can also receive $50 off Restylane or Sculptra, which I already told you can be used in the neck, when you book an appointment by October 21st and sign up with Aspire. Aspire is a program that helps get you points to save more money in the future as well. And these can be combined with the package purchase. So I think we're going to pause there for a second, but don't go away because we're just going to go on to our live demo. And after live demo, we're also going to have time for questions and answers. Sure. It's that music that I hate. I don't think we can. So we're back. I just want to introduce everybody who's here in your video. First of all, Bree, our wonderful medical assistant, very knowledgeable in cosmetics. Our beautiful patient, Kenna, who has agreed to have today's treatment. I want to pause for a quick moment and tell you that we're going to use Daxxify for today's treatment. Again, I already mentioned it's one of the US FDA approved neuromodulators, works very similarly to the other neuromodulators on the market, and they all have their own dosing. If you have any questions about that, we can address it in Q&A. So I might ask you to come a little closer so you can just see. So I'm first just going to clean everything like we always do. That's so important to make sure that the skin is completely clean. And I'm going to ask Bree to clean the other side. And then I'm actually going to show you just marking ahead of time before I actually do the treatment. Hopefully the pencil will work on camera. But remember what we said, that there's a muscle here. And if you've ever wondered what's causing those bands, it's the edge of the muscle that I showed you, the platysma muscle. So recall I mentioned that this muscle inherently has a downward pull. That means if we inject the area right under here, we can release things to be stronger in a more upward direction. So that actually works really well. And you can see the bands in here. I want to make a comment that will make sense to you about the way bands are treated. Remember that the way these treatments work is by preventing any message to get through. So the bands that are there when you're not moving are less likely to be treated than the bands that happen. So can you tighten your neck a little bit? Yeah. So you can see some of the banding is exacerbated by movement, and that's the part of the band that will have the best result because of the way that the neuromodulator and the Daxxify work. So I'm just going to show you how simple this treatment is. We cleaned, and then I'm going to have Kenna just move your head a little bit like that. And then we just do very simple little pokes right here. And she's being so good. And I think I'll just show you half the neck, and I'll treat the other half of Kenna's neck off camera. That way you can see what we're doing, but also have a chance to ask questions. Some people will actually treat down in here. I mostly, because of the way the Nefertiti, the way I think about the Nefertiti, I really just treat up along the jawline and not in through here. And then I'm just going to have you move a little bit like that, kind of great. And then I'll just take the edge of the banding and inject just a little bit. And Brie, I'm going to hand you a sharp. And you can see sometimes there's a little bleeding, and that's completely normal. And again, we just pull the band out and continue to treat. Kenna, can you describe how much pain you're having or how much discomfort you're having with this?
None.
None. She might be telling a little bit of a lie to make me look good, but for the most part, it really is not a painful procedure for any of you who've had neuromodulator. And that is the end of one half. The other side, sharp to you, would look exactly the same. So if you just hold, because the way we do our video, we're going to need to switch back to a slightly different video, and then we'll go to Q&A. Okay. Okay, so we're back, and I'm going to take a quick look at some of the questions that might have popped up. Let me pull up Q&A for a second. So the question is Agnes like Morpheus? That's such a great question, and I've worked with both. The Agnes is actually a little more intense in some ways, but it's a great question because they both use radio frequency microneedling. In addition, the Agnes actually has a capability of dissolving and treating fat. So for instance, for the fat pads under the eye, you can do a directed treatment to have some reduction in the fat pads. Also because jowling, and again, you're never going to get rid of complete jowling or jawline laxity, but you can treat some of the fat that contributes. So there's that added benefit to using the Agnes versus the Morpheus. Again, Morpheus is also a very nice treatment. It's just that they're slightly different in that way. And also that the Agnes has a different the way that the energy is delivered, the handpiece is quite different. I hope that answers the question for that individual. And if you have more, go ahead. And if there's any other questions, I'm happy to answer them. But I don't see any more. Oh, there's another one. How painful is the Agnes or Softwave in comparison to Fraxel? Great question. I would say that actually Fraxel is a slightly bit easier to control the feeling of pain. With the soft wave pushes energy a little deeper, so it's hard to numb the deep layers. It feels sort of like zingy. I had a soft wave myself. It was a gift I gave myself for my 50th birthday, and at the time, I didn't have access to a SoftWave in my office. So I did a ton of research deciding which technology I wanted to invest in for myself. And I did it with a colleague in Florida, and I did choose SoftWave. I found it very, very tolerable to do it. We can do numbing topically, and then certainly any other distraction technique can be helpful. The Agnes has injected numbing associated with it. So we do put lidocaine into the deeper layers where we're going to treat, which really minimizes the pain on the Agnes. So the Agnes and Fraxel are very easy. And then the soft wave, because the energy is transmitted a little deeper, you can feel a little more like a zingy or a rubber banding feeling. But again, I had full face and neck personally, and I did not have a problem with the pain whatsoever. Next question on Sculptra and necklines. So if I were going to treat a specific line, for instance, if you had a necklace line that really bothered you, I'd probably pick a filler because it's very targeted. Sculptra, the way Sculptra works is it harnesses your own body's capability of making collagen. So it's actually not a filler. It's a stimulator. And they have some really cool recent studies showing that the way that it works, it has all these new signaling molecules. It makes elastin, which is also a youthful part of the skin, and collagen. So again, harnessing your own body's ability takes a few months, injected as a liquid under the skin, resorbed, and makes new collagen. So it can lead to widespread neck rejuvenation and skin rejuvenation. However, again, it depends what your goal is. If your goal is a specific line to fill, I would probably recommend a filler. But if your goal is overall neck skin rejuvenation, then you could look at Sculptra. I hope that answered that question. Is Agnes a safe and effective treatment for under eye wrinkles? Yes. I think it's very efficacious. The big downside with Agnes under the eyes is the possibility of bruising. So if you're a bruiser, there is a chance of that happening, like there is with any treatment that has a needle associated. Again, the Agnes is delivered through a needle type treatment. So, but other than that, because of the possibility of also using the part of the Agnes that can help dissolve some fat, you're looking like a 20 to 30% improvement in under eye. And then a different on top of that is the delivery system for the skin. So it is efficacious for those areas. Thank you for these questions. I love them. So happy to answer any others. I don't see any other questions. But of course, we're always available here for consultation. Oh, there's another. Do I believe in Botox for the jawline? So I want to go back and use the term Botox loosely because, again, we have Botox, Daxxify, Xeomin, and Dysport in our office. So all four can be used efficaciously in the jawline. And that's what I just demoed. So I guess the question is, do I think other than releasing the platysma, which I showed, that muscle that pulls down along the jawline, I think that's best use for a neuromodulator in the jawline. I'm not sure if there's another use other than in the chin, where sometimes people pull really hard with the muscle that's in the midline here, and it pulls back and makes the chin look a little bit less strong and gives less harmony to the jawline, and you can release that pretty easily. Or that dimpled look that sometimes can happen, we call it peau d'orange, which means like orange peel look. Those are both also very well treated with the neuromodulators. I hope that answers that question. I'm more curious with the jawline on the sides to pull back the smile lines. I don't think that it would be very helpful for that, basically. I don't think it can pull anything. It doesn't The truth about neuromodulators, they don't have any lifting power or pulling power, only to relax things. And maybe you're asking about the corners of the mouth. I'll touch on that as well. The muscle that pulls down the corners of the mouth is called the depressor muscle, and that depressor can also be treated and released effectively to get the corners to lift. Now remember, when you release, you're only getting a couple millimeters of change, but that can be enough to be very impactful for a face. I hope that helps as well. So corners of the mouth as well. Any other questions? I don't see any others. So hope to see you soon. Thanks for tuning in. Bye.